Hi, this is a quick guide in regards to the use of the speaking valve, Passy Muir valve, for patients with tracheostomy. The main purpose of the speaking valve, Passy Muir valve, is for vocalization and a safe swallow. And there are a couple of steps that we have to follow in order for the patient to wear the speaking valve in a safe manner. First, we are checking the vitals and make sure they are stable, followed by completing a deep suction of the patient with a T-piece, and followed by a deflation of the cuff. As you can see, we have two cuffs, an inner cuff right here and an outer cuff. This is the reflection of the inner one that we can actually not be able to visualize on a regular patient. So the moment we have the outer cuff deflated, we know that the inner cuff is deflated as well. So we're gonna see what happens. We're gonna use a syringe, a regular one. I have right now a 5 cc syringe, and we are going to deflate the cuff, take all the air out. And as you can see, the inner cuff is deflating as well, creating now a free path for the air to move upper, hit the vocal folds, and help the patient to have a voice. It's very important for the cuff to be deflated, otherwise the patient can be compromised. It's unsafe if we place the speaking valve without the cuff being deflated. This is very important step, please don't forget. Then we are placing the speaking valve on the tracheostomy. It's very easy. We hold onto the trach so we won't move it along with the speaking valve. And with a nice turn, clockwise turn, we are placing the trach. The patient is safe, might have a couple of coughs in the beginning, but other than that, the patient should be safe, should have a voice, and wear the speaking valve, either all waking hours, the patient does not wear the speaking valve when sleeping, or as much as tolerated according with the vital signs that we have to monitor. When we take the speaking valve off, we have to hold again the trach, and with a turn, usually counterclockwise, we take the speaking valve off. Of course, the patient is going to be provided with a source of oxygen, a T-piece, a trach collar, a ventilator. If the patient is on a vent, then we need a respiratory therapist to be with us at all times when the speaking valve is placed on the trach. The speaking valve is also known as a Passy Muir valve, and it's going to be placed in the room with the patient if the nurse is the one who can place the speaking valve on the patient, so the all-day wear can happen. If the speaking valve is not in the room, means that is with a speech pathologist, and the patient require like special supervision during wear. The cleaning of the speaking valve at the end of the session with warm water, no soap, and placed back in the box that is provided in a little packet that comes with, and is left in the patient's room. Signs about and warnings about cuff that needs to be deflated is placed on the speaking valve and in the room with the patient. So again, please do not forget to deflate the cuff before you place the speaking valve. For any other questions, you have information and a guide for each of you that is placed at a nurse's station and available to you at any time when you have a patient with tracheostomy. Thank you so much.